I'm Nancy Baxter. I'm a senior adjunct scientist at ICES and head of the Melbourne School of Population and Global Health at University of Melbourne. Think of a surgeon. What do you think of? Most people think of a man, and this has an effect on the lives and work of female surgeons in the province of Ontario, but also patients. We explored this in our paper, Sex Differences in the Pattern of Patient Referrals to Male and Female Surgeons, published in JAMA Surgery in 2021. Many studies have demonstrated there is a gender pay gap in medicine, and that the gap is highest for those in surgical specialties. We recently did some work looking at remuneration per hour spent in the operating room and demonstrated that this was substantially lower for women than men. Essentially, women are paid less per hour than men in surgery. We wanted to look into why this might occur, and fortunately we have access through ICES to one of the best databases in the world to look at this. We essentially have information on all patients referred to surgeons, who they're referred by, and then what happens to them afterward. So we looked at patient referrals between January 1997 to December of 2016 and followed these patients forward to 2021 to see what happened to them. We looked at how many referrals went to women, how many referrals went to male surgeons. We looked at who referred them, what the sex of the referring physician was, and looked to see whether this influenced how the referrals happened. We did something called discrete choice modeling, which is a fairly sophisticated technique to try to control for all other influences, like what kind of surgeon you are, what kind of patient, how available you are, etc., to see what the biases were in terms of referrals. And what we found was pretty stunning, stunning in a bad way. What we found that was male physicians were 32% more likely to refer to a male surgeon. So male physicians were less likely, controlling for all other things, to refer the same patient to a female surgeon than to a male surgeon. There was a slight bias for female referring physicians to refer to female surgeons, but this was much smaller, so only about 2%. So what we demonstrated was that male physicians appear to have a referral preference for male surgeons. We also found that this difference was not narrowing over time or as more women entered surgery. Such preferences led to lower volumes of referrals to female surgeons, and additionally, there were fewer operative referrals. So patients who did not need an operation were referred to female surgeons more frequently than to male surgeons. And this clearly contributes to sex-based inequities in medicine. This has important implications in terms of not just how we improve the lives and careers of female surgeons, but also patients. The best surgeon for you might be a woman, but if you're not referred to them, then you'll never see them.